And our Ask the Doctor segment today, we're talking about COVID 19 and so many questions people have. What are the truths about it, and what effect may it have on the upcoming flu season? Well, Dr. Michael Luther practices medicine at Grandview Medical Group in Homewood. He joins us now by FaceTime to talk about this. Dr. Luther, good morning.
Good morning, everyone.
All right, so when we're talking about some of the myths about COVID 19, we know they are circulated a lot on social media, mainly about the reliability of case reporting. What are you hearing the most that concerns you, that you feel like people need to know the truth about?
So, what I hear the most is a lack of faith in the numbers that are being reported. The main issue seems to be that people believe that if one person in the home tests positive, that everyone in the home is counted as a positive at the state level, and that's just not true.
All right,
What happens
I have heard that so often. So, did someone said
and
that?
I think I know the answer.
Start? Yeah.
I think I know the answer. So, one person gets swabbed, that person gets reported to the state level with their birthday, the day they had symptoms, their full name. No one else in the house that information is gathered about. But what we tell people is, act out in the community like you already know you have it if you're that close of a contact with someone who does.
Mm-hmm.
So everyone in the house should consider themselves like they are a positive, even though they're not reported to any official testing group, not to the CDC, okay, not to the state health department.
So consider that you could be positive, but that's not being reported. That's the bottom line.
Exactly.
All right. Now let's move to the parameter that you think is most important in understanding how things may be getting worse or maybe getting better. What do you look at to determine those things?
Right. And to go back to another point of kind of lack of faith, people believe that when the ability to test went up in the state, that our case numbers went up, but it didn't really represent more disease. But the problem with that is testing doubled and cases went up 500%. So it wasn't just a ratio of how much testing we did. So when you look at the proportion of people getting tested that come back positive, called the percent positivity, you want to see that really low. 5% would be a good number. We were hitting 20% this week. We're in the upper teens right now, meaning there are more people in the community being checked, but they're being checked because there's more disease in the community. So overall cases show up first, hospitalizations show up second, which also at an all-time high in the state. And then, unfortunately, deaths lag behind that anywhere from 2 to 4 weeks. But that percent positivity is what we need to be watching to see if we're testing enough people to find negatives around the positive. And I think a good way to follow those numbers is a website called BamaTracker.com. It's a very good, easy to read, easy to understand set of graphs that you can look at every few days. It helps me every day.
Okay, so we know that medical professionals like yourself have learned probably something about COVID-19 almost every day, or at least every week. Are we still seeing people walking around who may be COVID positive, but they don't realize it, and they have no symptoms?
Exactly. There's been some discussion if those asymptomatic or non-symptomatic people can still spread the disease, and the answer is 100% yes, you can. Those who are coughing and sneezing are pushing more air out with the virus in it, so they're going to push more virus towards the person near them. But the person who is passively breathing, speaking, singing, all of these things are going to also pass those particles and can lead to infection. And unfortunately, those who are going to be symptomatic are infectious for about 2 days before they even become symptomatic. So you could be sitting at home right now with your family, not knowing that you picked it up at work, and you are already infecting those around you. And that's why this disease is so good at being what it is, because it can infect you before you even know that it exists in your home.
So it sounds like you're not saying wear a mask in your own home, but maybe practice social distancing in your home just to be careful. We do at our house.
Yes. So actually, I did hear this last week, people at the highest level suggesting that if there's a really vulnerable person in your home, someone with a lot of diseases, lung disease, diabetes, cancer treatment, that you would even consider wearing masks in the home when you can. For most people who are healthy, that's not been suggested so far. But the tricky thing about this disease is it is a disease of people who like each other. This isn't the stranger passing you in a store that gives it to you. It's someone you spend at least 15 minutes, at least 6 feet close to them. And you do that multiple times throughout a day, throughout a week. It's people at home, it's people at the office, it's people at a party, and then it's at other social events like weddings, funerals, work events, where this really seems to be spreading the most.
All right, in the time we have left, let's talk about, we didn't want to get to this point that we had to be concerned about COVID-19 and flu season at the same time. And what are we looking at here, and what are your concerns?
So because the flu symptoms and coronavirus symptoms are so similar, we're not going to be able to tell when the person seeks attention. We're going to have to be prepared to test them for both and to quarantine people for both. So get your flu shot. That's what I would say to everyone who's able. Get your flu shot when it's available. And which also brings up another good point when we talk about health resources. Don't forget your cancer screenings. Don't stay home if you have an emergency. Seek emergency care. Go to the hospital. Go to the emergency room. We at Grandview, we're ready to take people in our offices. We're ready to do telehealth visits. But don't skip out on the things we already know are the right thing to do. Because honestly, your doctor's office is probably the safest place in town because we're paying the most attention to mitigating the risk for spreading coronavirus.
All right, Dr. Michael Luther, thank you. Thanks for being with us today.
You guys have a great day.
Okay, you too. All right, now here's JJ Pruitt.
Thank you, Dennis. The itty bitty magic.